I'm Bill Nelson, Director of the Sidney Kimmel Comprehensive Cancer Center at Johns Hopkins and a member of the Jimmy V Foundation Scientific Advisory Board. We're here today to celebrate one of the V Foundation scholars, Vasan Yajnasubramanian. Vasan, I pass you this V to remember when it comes to a cure for cancer, never give up, don't ever give up.
Thank you, Bill. In my laboratory, we're focused on trying to understand how genetic and epigenetic alterations can be used to improve patient outcomes. And we try to focus very much on using a basic understanding of the biology of the genetic and epigenetic makeup of cancers to figure out how we can improve the types of activities we do in the clinic for diagnosis, for monitoring treatment response, for predicting who will benefit from therapy, and ultimately for predicting which therapies are going to be the best for any given patient for a given type of cancer and a given type of clinical modality. One of the major activities in the lab is to harness technologies to try to figure out how we can really address the challenges facing clinical medicine today. In a type of cancer called acute myeloid leukemia, it's a type of blood cancer, we're actually harnessing the power of next-generation sequencing technologies, attempting to use the complex genetic makeup of any individual's cancers to develop tests to figure out what types of therapies would be used for any given individual's cancers and for their management most effectively. Another major challenge that we're trying to address is the issue of prostate cancer management. In prostate cancer, one major controversy is to understand which patients have very aggressive disease that really require treatment and aggressive management options, and which patients have very indolent disease that can benefit from active surveillance and monitoring of their disease to understand when they should be treated more aggressively, but not necessarily right away. One of the major strategies for this is to use DNA methylation biomarkers, a type of epigenetic biomarker that can be informative in trying to understand which patients have very aggressive diseases. And in our laboratory, we're harnessing the latest technologies in next-generation sequencing and other modalities to try to identify, optimize, and deploy these epigenetic DNA methylation biomarkers for the purpose of identifying individuals with aggressive disease so that we can identify those who require treatment right away. This is ongoing work that requires input from laboratory experts, from clinical experts, and from laboratory medicine experts, and this is a team that we've been proud to assemble here at Hopkins with generous support from the V Foundation to do so.
We'd like to congratulate the V Foundation for 20 years of supporting the best and brightest in cancer research. Like Vasan here, I can think of no better way to honor Jimmy V and his dream.
Thank you.